This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, as February rolls on, we continue our mission to educate you during this American Heart Month. So maybe you remember last week when we learned that every 34 seconds, somebody in this country suffers a heart attack. Well, that can scare you into paying attention. The question now is, are you one of those people? What if you were to become one of those people? You can take comfort in knowing that there are resources right here on Delmarva that aim to get your heart back into tip-top shape. You probably remember Caroline Farrell. She's a clinical exercise physiologist with Peninsula Regional Medical Center. Wonderful to have you again with us today.
Thank you for having me.
So I hear the term cardiac rehab tossed around a lot. But people say what is cardiac rehab?
Cardiac rehab is a place that we like our patients to go after they've had a heart attack or some kind of heart procedure to help rehab them back into a better state where they can function back in their day-to-day life. So it's an exercise program with a lot of education. It's a clinically monitored program, so you're working with nurses, exercise physiologists, respiratory therapists on some lifestyle modifications that you can make to get back to your day-to-day life to help rehab your heart as a muscle to get back to that good functioning level that we'd like to see it.
Okay, so is this kind of like learning to swim? Do you just throw me in all at once, or are there like different phases at least to?
There are definitely different phases, and it's a huge education portion. The first phase of cardiac rehab is actually when you're an inpatient in the hospital, so we see you immediately post-op, and actually we've probably done some pre-op education with you already, so you know us. After you're discharged from the hospital, we encourage people to get a physician referral to enter a phase 2 program. That program is roughly a 12-week program where we'd like to see you 3 times a week. You come in, you're monitored by an EKG monitor every single time that you're there. We monitor your vitals, we monitor your blood pressure, your heart rate, your oxygen, all of that. And then there's phase 3, so once you've graduated, we call it graduating, when you finish your 12 weeks, you go to a phase 3 program. And it's a maintenance program, so you're only monitored once a month, but you're still getting the same kind of staff treatment from the nurses, the exercise physiologist, so you're under the same care, but now we've essentially rehabbed you to the point where you can exercise a little bit more independently.
Okay, so obviously this is good if you've had a heart attack or I presume surgery or something like that. Is this something you can do just to get in better condition?
Absolutely. It's actually what we call our phase 4 program, and we just call that adult fitness here at PRMC. So you don't need a clinical diagnosis to enter. You don't need to be a cardiac or a pulmonary patient. You can come and exercise with us, but you get the same kind of care. So you still get the same staffing, the same education, the same monitoring, even though you may not have those clinical diagnoses. It's great for especially patients who have been through something like this, so their spouse can come along, because a lot of this you need a big support system after.
Right.
But even if you don't know someone with those kind of diagnoses, it's great to come in and exercise with us, especially for the older population where it may not be as safe for them to exercise in just a regular gym.
So what kind of exercises are we talking here?
We focus on 2 main types of exercise, which would be your aerobic exercise, so what most people know is cardiovascular exercise, but then also resistance training, so we want to work with lightweight dumbbells, resistance bands, medicine balls to help build up some of that lean muscle mass for the endurance for that aerobic exercise.
What kind of results have you seen from
We see amazing results. We see anything from weight loss, which comes a lot from the education about the diet portion. We see patients who come in with a list of 17 medications that they take daily, and they're supposed to remember all these medications to help with all these various different things. A lot of times when patients are discharged from our program, that med list could essentially be cut in half or eliminated.
Wow.
Hopefully, that's the goal,
Right.
or at least, at the very least, bring down the dosages or the amount of times a day they have to take this medication. So the heart definitely functions much better after cardiac rehab. The goal would be, like I said, eliminate some of those medications, and hopefully they'll function better in their day-to-day life.
Medicine is good, but less is better.
Yes.
Gotcha.
Yes.
Okay. So just a reminder for you, just in case you want to know more excuse me, about the health of the heart thing going on with PRMC, you're still offering the free Women's Heart Program.
Yes, we offer that year-round, Tuesday and Thursday mornings. We do 4 appointments a morning. You just call us at the hospital. You can visit our website and make an appointment. Right now we're booked out through March. Heart Month has been great for us because we've been able to push the program a lot, but usually you can get an appointment pretty quickly with us. So.
Is this something we have to come to you to do? Is this something we can take home and do?
No, it's something that you would come in and see us for. We would do a full elaborate screening. It takes about an hour. But then we send you home with all of your results and education and some tips and things that you can work on at home. So it's something that we want you to learn from us when you come see us.
Right.
We're going to send all of your results to your doctor as well, so that we're all in the same loop here as far as what's going on. But then we'll give you some tips to go home to maybe help some of these numbers, like your cholesterol, like your blood pressure, and all that kind of stuff. So you definitely want to take that information home and work on it and think about it afterwards.
Take my education with you, and it's free.
It is absolutely free, 100%. You can have insurance, not have insurance. We don't take any of that information. You come in, we see you, and you leave. No payment necessary.
Wow. Caroline Farrell, thank you so much for sharing all the stuff. Well, you are good at what you do. Now,
Thank you.
This is potentially life-saving information. So if you would like to read more about it from PRMC, about the cardiac rehab program, all you have to do is go to delmarvalife.com. Thank you very much.
Thank you.